Alright, I officially welcome you to the day 2 of the UK NMC CBT practice for adult nursing. My name is Estakmajmai. I'm a certified nurse. Today, we're going to look at the clinical aspect of the UK NMC CBT for adult nursing. We're going to solve 25 multiple choice questions. I will tell you what the answers are and perhaps add reasons to why the answer is A, B, or C. But if you missed the day 1 lesson, there were some questions I asked and I'm going to give answers to them in this session. The very first question I asked was, how many attempts are there for NMC CBT? I know most of you answered right in the comment section. So you've got to have 3 attempts. What this means is that if you fail the first time, you can go the second and even the third, after which you should make sure you pass. And the second question that came forth was, does the CBT for nurses expire? I would say yes, in the sense that you have 2 years to complete your NMC registration, and you should understand that the CBT is part of the NMC registration. So if after 2 years you don't pass your CBT, or if after 2 years you don't complete your NMC registration, the application automatically closes and you have to start all over again. And the very last question here is, how is the CBT scored? In the day 1 series, I talked about the pass mark you need to get, or the number of questions you need to answer right to get the pass mark you are looking out for. But if you should ask me how the CBT is scored, it's just a pass or fail. So once you write your CBT and you pass, you go on your NMC portal and then you see pass. If you failed and you go on your NMC portal, you will see fail. So they won't specify the marks you had that got you the fail, or the marks you had that got you the pass. Now back to today's lesson. I hope you are really prepared for that. We're going to go one step at a time, and then I'll tell you what the answers are and perhaps the rationale. But before that, I'll give you 10 seconds to think of the answer, and then I'll come in with the right answer together with the rationale, and then we see how it goes. When caring for a patient who is Jehovah's Witness suffering a severe hemorrhage, what do you consider? Choose the correct answer. A. They are not to be resuscitated. B. They are not to be sedated. C. They are not to receive blood or blood products. D. They are to be cared for by professionals who are Jehovah's Witness. What do you think is the answer? You've got 10 seconds to think of it. Alright, time up. The answer is C. Jehovah's Witness typically refuse blood transfusion based on their religious beliefs. So if you have a friend who is a Jehovah's Witness, you can testify to the fact that they don't receive blood transfusion. So if they come to the hospital and they are short of blood, or their HB is very low to the point that they meet the threshold of blood transfusion, they might refuse. And it's just because of their religious belief. So as a healthcare professional, you must respect their autonomy and ensure that alternative treatment are considered whilst providing appropriate care. Always check for an advance directive for a blood refusal card to guide decision making. So you may be asking, what is an advance directive? It's a legal document that allows a person to outline their medical treatment preferences in case they become unable to communicate or make decisions for themselves. It ensures that healthcare professionals respect the patient's wishes regarding treatment like life support, resuscitation, and blood transfusions. And that makes the answer C. A doctor requests a lactate to be taken from a very unwell patient. What type of sample is taken? A. Blood gas. B. Urine sample. C. Full blood count. D. Stool sample. What do you think is the answer? Alright, so let's see what the answer is. The answer is possibly A. Blood gas. When we say a lactate test, it's usually performed using an arterial or venous blood gas sample. It measures lactic acid in the blood, which can indicate tissue hypoxia, sepsis, or metabolic disorders in critically ill patients. A piece of blood is taken from the veins or the artery to run a test. And with this test, we are looking at a couple of stuff: the lactate, potassium, sodium. We're looking at the partial pressure of oxygen in the body, the partial pressure of carbon dioxide in the body, bicarbonate, and all those stuff. So as a nurse, if you're asked to do a lactate test, then you are looking at doing a blood gas. When caring for a patient who does not speak English, how do you obtain information from the patient? Choose the correct answer. A. Find the information you need from medical notes. B. Ask the patient to draw pictures. C. Ask a family member to translate. And D. Use a face-to-face or online translator. What do you think is the correct answer? Let's see, you've got 10 seconds to do this. Yeah, time up. Let's see what the answer is. The answer is T, which is use a face-to-face or online translator. Using a professional interpreter, either in person or via online or video service, ensures accurate information or accurate communication, maintain patient's confidentiality, and avoid misunderstandings. When a drug error occurs and the patient has been assessed for any harm, what is the next priority? Choose the correct answer. A. Inform the patient of what has happened. B. Continue your drug rounds. C. Continue to administer the next dose. D. Call the patient's family. What do you think is the answer? It's time to do this. So you've got 10 seconds to choose the right answer. Let's start. What answer did you choose? Is it A or D? Let's see what the answer is. So the answer is A. Inform the patient of what has happened. Why is that the case? After assessing the patient for harm, the next priority is duty of candor, meaning healthcare professionals must be open and honest with the patient about the error. Remember, the error has been made on the patient. You've made the efforts to assess the patient to make sure that he or she is not in harm. The next thing you've got to do is to inform the patient about it, that this and this had happened, and this are what they've done to make sure that things are in check. Okay, so you inform the patient, you explain what has happened, the potential risk, and then the next steps you are taking. And right after that, you have to report the error, follow hospital policies, and document the incident. Every hospital may have a way of going about it, so you have to find out once you get in there. And you seek medical review, ensure any necessary corrective actions are taken. You inform the doctor for assessment and all those stuff, and you learn from the mistake. So here you've got to reflect and improve practice to prevent future errors. Which of the following diseases is notifiable to Public Health England? Choose the correct answer. A. Mumps. B. Clostridium difficile. C. Influenza. D. Human papilloma virus. What's the answer? You've got 10 seconds to do this. I believe in you. You can do it. Let's start. Yeah, time up. What answer did you choose? Let's see. The correct answer is A. Mumps. Mumps is a notifiable disease in the UK, meaning healthcare professionals must report it to the Public Health England, now part of the UK Health Security Agency. Reporting helps track outbreaks and implement public health measures. So if you encounter a patient with mumps, you've got to report it to the Public Health England. It's a public health issue. Okay, so yeah. The HPV, which is the human papilloma virus, vaccination prevents which disease? Choose the correct answer. A. Cervical cancer. B. Ovarian cancer. C. Bowel cancer. D. Testicular cancer. What's the answer? You've got 10 seconds to do this. I believe in you. You can do it. Let's try. So the answer is A. Cervical cancer. You see, the HPV vaccine protects against high risk of HPV strains, which cause over 99% of cervical cancer. So bear in mind that the HPV vaccination is for people who want to prevent themselves from getting cervical cancer. Which of the following professions are specifically trained in smoking cessation? Choose the correct answer. A. Hypnotherapist. B. Pharmacist. C. Dietitian. And D. Chiropractor. What's the answer? You've got 10 seconds to do this. So what answer did you choose? So the correct answer is B. Pharmacists are specifically trained in smoking cessation and can provide nicotine replacement therapy, which comes in the form of patches, gums, and then lozenges. They can also give out prescription medication and also ensure behavioral support and referral to smoking cessation services. So the best answer here is B. Let's look at why A, C, and D are not considered the best answers here. You may be asking, who is a hypnotherapist? They may offer alternative therapy but not medically trained for smoking cessation. So they use what we call the psychotherapy, to get people to get better. and dietitian focuses on nutrition, not smoking cessation. Chiropractor specializes in musculoskeletal issues, not smoking cessation. So that's something you have to take into consideration. Which of the following is a health visitor's responsibility? Choose the correct answer. A. Giving emergency first aid and treatment in a crisis. B. Administering immunizations. C. Supporting the physical and emotional growth of a child. D. Assessing speech and then language development. What do you think is the answer? It's time to choose your best answer. So let's start. So what answer did you choose? Let's look at it. The correct answer is C. Supporting the physical and emotional growth of a child. Health visitors primarily focus on promoting the health and well-being of families with young children, providing advice and support to a variety of topics, including child's development, parenting, and then family health. Whilst they may help with assessment and referrals for speech and language development, their main responsibility is supporting overall physical and emotional growth of child and then mothers. What are the common complications of uncontrolled blood sugar levels in diabetic patients? Choose the correct answer. So A, we have peripheral vascular disease, irritable bowels, liver failure. B, retinopathy, memory loss, joint pain. C, renal failure, joint pain, urinary incontinence. D, retinopathy, peripheral vascular disease, renal failure. Which is the correct answer? You've got 10 seconds to do this. Time up, and the answer is D. So retinopathy, peripheral vascular disease, renal failure. Let's look at what the rationale is. Uncontrolled blood sugar levels in diabetic patients can lead to various complications. That is true, including diabetic retinopathy, which is damage to the eyes, peripheral vascular disease, which is poor circulation in the limbs, and renal failure, which is kidney damage. These complications arise due to long-term effects of high blood sugar level on blood vessels and organs. One thing I read is that when there's too much sugar in blood or glucose in blood, it causes the blood vessels to be hardened. The blood vessels have got muscles to contract and relax to push blood. Imagine what happens when the blood vessels harden. The blood will just stay at one point, not moving, especially if it falls in the limbs. So that is something you have to take into consideration. Which of the following describes a quantitative method of research? Choose the correct answer. A. Reviewing published research. B. Collection of numerical data. C. Collecting people's views and opinions. D. Exploring a phenomenon by interviewing participants. What's the correct answer? Let's do it. So the correct answer here is B. Collection of numerical data. You see, quantitative research involves the collection and analysis of numerical data to quantify variables and uncover patterns or trends. It typically uses tools like surveys, experiment, or statistical analysis. So the simple explanation I can give to quantitative research is that you're dealing with numbers. And qualitative here has to do with getting people's opinions and views about a topic or an issue. Scale 2 on the News 2 chart is used for which patient group? Choose the correct answer. A. Those with urinary catheter. B. Carbon dioxide retaining patients. C. Those receiving intravenous therapy. D. Those who have been exposed to carbon monoxide. What is the answer? What answer did you choose? Okay, let's look at it. The answer is B. Carbon dioxide retaining patient. On the News 2 chart, a score of 2 indicates a moderate concern and is commonly used for patients who are carbon dioxide retaining, such as those with chronic obstructive pulmonary disease, which is COPD. These patients may require close monitoring of their respiratory status. So the simple explanation I can add to this is that on the News 2 chart, there are 2 scales. You have the scale 1 and then the scale 2. Scale 1 is used for normal or ordinary patients, while scale 2 is specifically used for people who are carbon dioxide retaining. So such patients may include those with COPD, which is chronic obstructive pulmonary disease. So you see this often in most hospitals in the UK. where a patient comes with COPD and they are like, okay, let's use scale 2. And with the scale 2, we're looking at oxygen saturation of 88 to 92%. Whilst on the scale 1, we're looking at 92 to 96% or above. Patients with chronic pain conditions are screened for which of the following? Choose the correct answer. A. Coronary heart disease. B. Bowel cancer. C. Schizophrenia. D. Low mood and depression. What's the answer? You've got 10 seconds to do this. I believe in you. You can do it. Let's see. What answer did you choose? So the correct answer here is D, which is low mood and then depression. Let's look at how the reason is. Patients with chronic pain conditions are often screened for low mood and then depression, as chronic pain can significantly impact mental health. Depression is common among individuals with ongoing pain, and addressing mental health is an important part of managing chronic pain. If someone is in chronic pain, they tend to have low moods and depression. They tend to be more reserved, not very active and stuff. So you've got to assess the impact on their mental health. What does it mean to performance manage an employee? Choose the correct answer. A. When a person is promoted. B. When someone is being dismissed from their workplace. C. Developing a person to fulfill the expectations of their role. D. When performance is exceeding the expected level. What do you think is the answer? You've got 10 seconds to prove me wrong. So the answer is C. Developing a person to fulfill the expectations of their role. Performance managing an employee involves supporting and developing them to meet the expected standards and then fulfill the requirements of their role. This can include providing feedback, setting goals, offering training, and addressing any performance issues to help the employee improve and succeed. Which of the following groups has the highest rates of suicide? Choose the correct answer. A. Children under 18. B. Men. C. Women. D. Elderly over 75 years. So the answer here is B. Men. Why is men at high risk of suicide? Men, particularly middle-aged men, have the highest rate of suicide. While suicide can affect individuals across various age groups and demographics, men tend to have a significantly higher suicide rate than women in many countries. So yeah. A patient presents with a productive cough, low saturations, high respiratory rate, raised lactate with news of 9. Which of the following does this indicate? Choose the correct answer. A. Bowel obstruction. B. Chest sepsis. C. Deep vein thrombosis, which is DVT. D. Myocardial infarction. What's the correct answer? You've got 10 seconds to do this. Let's look at the correct answer. I believe that I had this one correct. So the answer here is B. Chest sepsis. A patient presenting with a productive cough. 1. Low oxygen saturation. 2. High respiratory rate, raised lactate, and a new score of 9 is likely experiencing chest sepsis. In other words, chest infection. So these are signs of pneumonia, which could be due to pneumonia or a similar respiratory infection. Sepsis can cause systemic signs such as raised lactate, indicating tissue hypoxia or impaired circulation. So hypoxia is much more like low oxygen in blood, high respiratory rate due to respiratory distress, or low saturation due to impaired gas exchange in the lungs. A new score of 9 indicates a high level of concern and suggests the need for immediate medical attention or intervention. What group of drugs are used in patient-controlled analgesia? Choose the correct answer. A. Paracetamol. B. Opioids. C. Steroids. D. Non-steroidal anti-inflammatory. What's the correct answer? You've got 10 seconds to prove me wrong. So the very answer here is B. Opioids. Patient-controlled analgesia is commonly known as PCA. Typically uses opioids such as morphine, fentanyl, hydromorphine to allow patients to self-administer pain relief within safe limits set by the healthcare providers. PCA is commonly used for post-surgical pain management and severe acute pain conditions. The PCA is much more of a pain control measure to ensure that patients with chronic pain, especially those who've got sickle cell, those who have undergone surgeries and stuff, are able to administer pain medications all by themselves within the limits which have been set by the healthcare professional. So the medication will be running through a machine. They've got a controller to self-administer an amount of it into their system within a specified limit. Patients who are put on furosemide are one of which common side effects? Choose the correct answer. A. Constipation. B. Oliguria. C. Polyuria. D. Diarrhea. And the answer is C. Polyuria. Furosemide is a loop diuretic. If you don't know, there are different types of diuretic. We normally call furosemide, water tablet. What this means is that it's getting rid of excess water in the body. In that case, it increases urine output by promoting the excretion of sodium and water from the kidneys. Patients are often warned about polyuria, which is excessive urination, as a common side effect, especially after taking the medication. You have a patient who is choking. You have administered 5 back slaps with no success. What is the next step? Choose the correct answer. A. Give 5 more back slaps. B. Monitor the patient. C. Start basic life support. D. Give 5 abdominal thrust. The answer here is D. Give 5 abdominal thrusts. If 5 back slaps do not clear the airway obstruction, the next step is to administer 5 abdominal thrusts, which is called the Heimlich maneuver. This involves standing behind a patient, placing a face just above their navel, and applying inward and outward pressure to force out the obstruction. If the patient is still choking after alternating between 5 back slaps and then 5 abdominal thrusts, continue the cycle and call emergency services immediately. If the patient becomes unresponsive, begin basic life support, which is CPR. External factors which increase the risk of pressure damage are A. Equipment, age, and then pressure. B. Moisture, pressure, diabetes. C. Pressure, shear, and friction. D. Pressure, moisture, and age. And there we go, time up. What answer did you go for? The correct answer here is C. Pressure, shear, and then friction. Prolonged pressure on a specific area reduces blood flow, leading to tissue damage. So that's something I'll take into consideration. And shear, when skin moves in one direction whilst underlying tissues move in another, it can cause deep tissue damage. And friction is repeated rubbing of the skin against the surface, which can be sheaths. This can lead to skin breakdown. So these are the 3 things that come together to give a patient pressure ulcer. You are caring for a patient who has a stomach formation and they are ready for discharge. What advice do you give the patient? Choose the correct answer. A. Wait until the bag is full before changing it and clean with soapy water. B. Use perfume soaps to aid odor control. C. Keep the area moist when changing the bag, advocating the use of oils to help the surrounding skin. D. Clean with water, trying to keep fecal fluid away from the skin to minimize irritation. Which is the correct answer? The correct answer is D. Clean with water, trying to keep fecal fluid away from the skin to minimize irritation. Patients with a stomach should be advised to clean the stomach and surrounding skin with water only, avoiding harsh or perfumed soaps as they can cause irritation. Prevent fecal fluid from coming into contact with the skin to avoid irritation or skin breakdown. And also change the stomach bag before it becomes full to prevent leaks and discomfort. And you also have to make sure that you are avoiding using oils or creams around the stomach as they can prevent the adhesive from sticking properly. What is a whistleblowing policy? Choose the correct answer. A. A policy that guides staff on raising concerns about safety and practice. B. A government-led policy that advises trust on care. C. A major incident policy. D. A policy that helps employers manage staff. Which one is the correct answer? Alright, the correct answer is A. A policy that guards staff on raising concerns about safety and practice. A whistleblowing policy is designed to protect staff who report concerns about unsafe practices, malpractice, misconduct, or ethical issues within an organization. It encourages a culture of openness and accountability by allowing employees to report concerns confidentially and without fear of retaliation, ensuring that concerns about patient safety, workplace safety, or unethical behavior are addressed appropriately. What is the responsibility of an occupational therapist? Choose the correct answer. A. Assessing someone's ability to see. B. Reviewing and adjusting prescribed medication. C. Supporting people whose health may prevent them from completing their normal activity. D. Assessing injury or damage in a patient. Which is the correct answer? The correct answer is C. Supporting people whose health may prevent them from completing their normal activity. Occupational therapists, they are normally called OTs, help individuals who face physical, mental, or emotional challenges that prevent them from carrying out everyday tasks. Their roles include assessing and supporting people with disabilities, injuries, or chronic illnesses to improve their ability to perform daily activities. They also recommend adaptive equipment and modification to help individuals maintain independence. They help individuals regain skills for work, self-care, or leisure activities after an illness or injury. One of their roles is also providing rehabilitation plans and strategies to enhance mobility and functionality. Whose role is it to lobby the government to support nurses and make positive change to the profession and working conditions? Choose the correct answer. A. The individual teams of nurses. B. Chief Executive of the Trust. C. The Human Resource Department. D. Nursing unions. Which is the correct answer? The correct answer is T. Nursing unions. You see, nursing unions play a crucial role in lobbying the government to support nurses and improve their working conditions. They advocate for better pay, staffing levels, and workplace safety. They negotiate with government and healthcare organizations to implement policies that benefit nurses. They provide legal and professional support for nurses facing workplace issues. And also, they campaign for positive changes in healthcare policies and nursing education. So that makes the answer D. When running a ward or unit, which of the following is the priority at the start of the shift? Choose the correct answer. A. Calling and updating family or carers on patients' conditions. B. Check the staff numbers match patient acuity. C. To give out the breakfast. D. Make sure a doctor is on the ward. Which is the correct answer? The correct answer is B. Check the staff numbers match patient acuity. Why is this the case? You see, at the start of the shift, the priority is to ensure that staffing levels are appropriate for the number of patients and their acuity, which is the level of care required. This is essential because it ensures patient safety by having enough nurses to manage care. It also distributes workload fairly among staff, plan effective delegation of tasks, and also addresses any immediate staffing issues, such as calling in extra help if needed. In simple terms, whoever is coordinating the shift has to make sure that the number of nurses available match up to the level of care the patients need, so that if there's any shortage somewhere, that can be rectified on time. When supervising a student nurse, when do you deliver feedback? Choose the correct answer. A. At the midpoint and end point of placement. B. Continuously throughout the placement. C. At the end of the placement. D. Feedback is provided by the university, so you do not need to deliver this. What is the correct answer? The correct answer here is B. Continuously throughout the placement. Providing continuous feedback ensures that the student nurse learns and improves in real time. It also helps them to gain confidence and refine their skills throughout the placement. And it also gives them the opportunity to correct mistakes and build confidence and feel supported and guided in their learning journey. This brings us to the end of today's lesson. If you enjoyed every bit of it, please endeavor to hit the like button and also share. And above all, if you have not subscribed yet, please do that so that I can get the subsequent lessons on time. Thank you very much. Let's meet in day 3.